So how do you make a healthcare marketing plan or a strategy that really works? And that's something that we get asked quite a bit, because we do quite a bit of work in the healthcare industry. Now, there is so much going on in that healthcare space. There's all the big businesses that are creating, well, actually big and small businesses that are creating new pharmaceuticals, new ways to operate, machines, tools, new ways. And then there's the research side. There's all the people that are looking for cures for some of the things that are, taking lives earlier than they should. And there's a lot of great work going on there. And those people need funding. And then there's all of the people, the specialists, the facilities, the carers that look after people as they get over an illness or have an operation or are dealing with some kind of disease, or even just old age as we all age. There's so much that is there, and there are so many competitors. There's so much voice, and it's all noise. I like to think about it as this field that's full of all these people saying, no, me, no, look at me, no, look at me. What we like to think of when we do marketing and when we're working on a brand strategy or a marketing strategy, we like to think about what's the way that we can get your voice seen and heard, almost like follow me up the top of the mountain so we can stake a claim, so that people can see us and people can hear us. And so we work with a lot of businesses in being seen and heard. And where we always start is at the brand positioning. First of all, you need to know who you are and what you stand for and why you're different in the market. And I've got some examples which I'll do some videos on, which you can also watch, on some of the big players in this medical space and how they've done it. I'll deconstruct those for you. But let me give you a quick example of a hero brand that we did for a client who is developing an app. So hero brands are there to save the day. Just like Superman, they come in, they're there when you need them most. And that worked particularly well with our client's idea, because he was developing an app that worked with other third-party devices. So if you were trying to maintain health or prevent some kind of health episode happening, then you would plug in a third-party device that would measure, and would be all of that content, that data would go into his program, and using algorithms and what it knows about you, it would start to give you feedback on how you're tracking. It's a little bit like the canary in the gold mine, if you like. Imagine that in an aged care facility where you've got people that have some kind of diseases or some illnesses, and if you're tracking things daily, say it's just blood pressure, as soon as there's a change, the app will then connect to your doctor or to your carer and say, hey, look, there's something going on before that episode actually happens. And that's really valuable. And that is a little bit like Superman. So in all the stories that we tell with this brand, it is about how we're there to prevent and how we're there to help save you if you need it most. So this is a really good diagram. It's you, this is where the data goes, and then this is the bit where the saving happens. So check out this guy's website. It's jevityapp.com. And it'll give you an idea of how we position this particular health brand as a hero.